recording this, and tomorrow up on our, let me make sure to start recording. Yep. Tomorrow up on the on our site at www.villagesofsantafe.org, we will post this recording and any other handouts that Dr. Romero and Susanna have, and you'll be able to download that information as well. So I'm going to mute myself, so if my dog starts barking, you won't hear it. Harriet, if you want to introduce our speakers.
I'm really very delighted to introduce them today. Yes. I first met our speaker, Dr. Kathleen Romero, through the State Hearing Loss Association. She had extended her practice into Santa Fe as well as Albuquerque to include people up here. And several people had begun seeing her, and they were so delighted with working with her that I decided she would be my audiologist as well. And later on, Susana Santillan is the New Mexico Commission for Deaf and Hard of Hearing Community Advocacy Specialist at the Los Angeles office and also Albuquerque. And as we start, we just want you to know they both have very interesting bios. And if you want to see their biography, it should be in the invitation that you got today. And I think tomorrow you will also have that, right, and that their bios if people want to see more about each of them. So, Dr. Romero, please tell us about our hearing loss or our good hearing and everything to do with it.
All right, well, I'm excited to be here. I thank you all for having me. I have a general list and topics that I know we want to go over and we want to review. And so I want to touch on as many of them as I can, but certainly if anybody has questions or wants me to elaborate on something, I would be happy to stop or slow down and go back to that. I have been an audiologist now for going on 12 years. I've been in New Mexico the whole time, and I did my education in Arizona. And I have had the privilege of working with pretty much every age group out there. So my young kids, oh, sorry, that threw me off there. And so it's been a joy. I've spent most of my career working with hearing aids and hearing impaired with regard to protecting hearing all the way to fitting again with hearing aids. And so I feel like I have a lot of insight just in my experience as well as my education. Being here in Santa Fe is different than it is in Albuquerque, but some things remain the same. And one of the first questions on my list is, where do we go, or where's the best place to go to get your hearing tested? And if you want a true diagnostic hearing test, the best advice I can give is to see an audiologist. And the reason I say that is because an audiologist isn't going to primarily look at your hearing loss for the purpose of selling hearing aids. We're first and foremost looking at, is there something going on within the auditory system that needs to be evaluated further? I hear a lot of people who go to Costco or Sam's Club, and certainly that's a place to get a screening. Certainly if you're there and you're just curious about your hearing and do have some hearing loss, it's not a terrible place to start. But once you have somebody telling you you have hearing loss, you need hearing aids, it's super important that you get it checked out by an audiologist. And there are some dispensers that are good. The best advice I can give would be avoid free hearing tests. And the reason is, if they're giving a free hearing test, they're not billing through insurance. It's for the purpose, most likely, of fitting the hearing aid. So if you go to a place that gives a free hearing test and then leave and say, can I get a copy of that test? There's likely going to be a charge for that, or there's going to be a waiting period of some point. If you go to an audiologist or a practice where they're billing insurances, you have a right to take that test with you. you can get it tested there. And if you didn't really like the clinic, you have a right to take that diagnostic test to any audiologist or hearing aid dispenser or Costco, if you will, and go and get fitted with a hearing aid. So you don't want to start with a screening and then try and go get a hearing aid. I highly recommend you start with a diagnostic test and then decide if the hearing aid is where you're going to next. I see some questions on the chat. Do you all want me to address those right away or just keep going? I mean, I can talk about the one that's relevant, for example, the AARP.
Right. I think if there's something that you see that's relevant, that's fine.
Okay,
But I
That-
think we can give a little bit of background and then we can stop for our questions.
sounds good. Well, this one is interesting. The AARP has an online test. Does it work? And the easy answer and quick answer is yes, it would be able to identify somebody who has a moderate to severe hearing loss. But again, telling you have hearing loss isn't a good healthcare way to address it. So I think it's a great place to start. I think that if you can at least identify that there is some hearing loss, then you at least feel better about going in to see an audiologist, especially during these times now where we wondered, should we go and get our annual checkups? So again, online tests, they are a thing and they're getting better, but I still would say once you get that, the main idea is go in and get it diagnostically tested. Once you get diagnosed with the hearing loss, and again, not the online, I would say even the Costco's, if you want to go back there because that's where you feel cost-wise or for whatever reason, still go and get your diagnostic hearing test first. Now you've been diagnosed with the hearing loss. Now you need a hearing aid. Somebody tells you you need a hearing aid. If you're going to get benefit from a hearing aid, it's because you're perceiving deficits. So nobody should tell you you need a hearing aid. You likely have already noticed that you're struggling. You're struggling with family. You're struggling in noise. And so most people who need a hearing aid already know that they're struggling. So when you're trying to consider when it's time to buy a hearing aid, the hearing test is only one component. And I say that in the sense of myself, who might have a mild hearing loss, I would need a hearing aid when it affects my job, when it affects communication with my child or his teachers, versus somebody that waits a little longer because they're retired and they don't need it yet because their communication environment doesn't call for it. And that's the first thing is, do you feel you have enough deficit for a hearing aid? The hearing test just tells us how much hearing loss you have. And that is truly what guides us as to what kind of hearing aid you need. And everybody is different. There's not a one prescription best hearing aid solution for every person and for every hearing loss. So when you're considering a hearing aid, your first thing would be to consider cost. What are you comfortable spending? Because I dispense hearing aids in all different price ranges. And I can tell you, if somebody tells you you have to spend the most money to get the best hearing, that's not entirely correct. If your budget is something that's not $5,000, there are still great hearing aids that can fit your needs. Hearing aids and the cost of them has nothing to do with the size or, Bluetooth. I hear people say, well, I don't want Bluetooth. It's just that's more expensive. And the truth is it's really not. So you have to come into these appointments knowing what you're comfortable spending and know that whatever that number is, you should be able to get improved hearing with it. You shouldn't feel bad if your budget is different than somebody else's. Be willing to tell your audiologist, this is where I'm comfortable and these are my needs. For my patients, I recommend 3 during COVID because nobody can go to restaurants. Before this, I would say pick 4 situations that you find important. My grandkids, television, telephone, and restaurants. So that when you're deciding what you need in a hearing aid, we can check those off and make sure that whatever you get has the options that you're needing. And I can fit that regardless of what you're spending on the hearing aid. So what to consider when you're buying a hearing aid, first and foremost, is what your honest budget is, and 2, what your needs are. understanding that if you want all of these bells and whistles, it's going to come with a higher price tag. And that's a decision every single person makes. The next question that comes up is what types are best? And again, that's a tricky question. There's not one hearing aid that's best for everybody. And that's why you have to each come in, if you're going to approach this, with the things that are important to you, and then feel comfortable that the person you're talking to is truly giving you all the options, not just the same one for everybody. So an example would be the behind the ear versus the in the ear. There's not one that's better than the other. In fact, the components inside of it are very similar, and what it's actually doing at a basic level is the same. But somebody who wears glasses and oxygen and now a mask, that might not be the best option for them. So that's why it's difficult to say what is the best. Each style and each of your needs, that we should be able to find a hearing aid that would give you the benefit that you're wanting. The size of the hearing aid, and a lot of people don't know this, and it's shocking to me, is going to determine what types of assistive devices or things you can connect to it to help are going to be available. So the easy thing to remember is the smaller the hearing aid, the less technology they can put inside it. So if you want the really tiny one that nobody can see, you're likely not going to have access to Bluetooth. You're not going to have access to T-coil. Those types of assistive devices are going to be less compatible the smaller the hearing aid. But the ones that have all of that aren't very large. So don't go in thinking anything behind the ear is going to be large. They're just not. They're actually pretty small. But keep that in mind when you're deciding really tiny that no one can see. You are going to sacrifice some technologies. All right, I'm going to just kind of keep going here. I think I addressed the few that came up. Home care for someone that has hearing loss is something that is new, and it really, we're pushing home health care with the pandemic and how it's gone on. And every day I get emails from physicians that are putting together new ways to do telehealth and to find ways to give that service at home. And hearing aids are no different. In new technology, we have realized the need to minimize the amount of in-person appointments that we have, not just because of the pandemic now, but also maybe distance, especially in New Mexico. If I'm in Albuquerque and you just need a quick adjustment on your hearing aid, sometimes it's not easy to come all the way into the office. So for someone who needs to be at home because of travel restrictions, maybe they're physically not able to, pretty much all new hearing aids have a way to do remote programming directly through a smartphone. But it does have to be a smartphone. Can't be a flip phone. It has to be an iPhone or Android phone. And this has changed how we're doing healthcare with hearing, but not 100%. We're still finding that there is value in having you sit in front of us, talk about the issues, see physically what's happening. And so it doesn't take the place of the in-person, but certainly hearing aids have the option for people that are at home or don't want to come in as often, but do feel like, well, I do want the adjustments made as if I was going into the office. As far as the other side of my practice, the otology side, we're still finding it difficult to do medical types of appointments via telehealth. We still feel like if your ear is hurting, if you have a sore, if you're bleeding, the best thing is to come into the office and physically see your doctor. But from the hearing aid side, certainly we have really neat ways to go into your homes without you having to come out and going in and programming these hearing aids that you're buying. And this comes in all the price ranges. You don't have to spend the high end. It comes in those. It also comes in the entry level models as well. The next, as I talk about the cognitive part of hearing loss and how you have to understand that when you come in to get a hearing aid. And hearing is just one of the first parts of being able to communicate and actually take what you're hearing and understand it. And it's one of the most difficult parts for family So when I have patients come in and their son or daughter comes in with them, and their expectations of what the communication looks like after we get hearing aids, it's rare that they're considering, or that the patient is considering, things like memory, things like vision, things like, of course, any cognitive slowdown that takes more processing. A hearing aid does not fix that. And family has to understand it almost as much as each individual person has to understand. Once you get the hearing aids, you get the information, but then it still has to process through. And that is why we see children who we fit with moderate to severe hearing losses, and they just perform amazing. You almost wonder, what is the difference, right? Why can't my 75-year-old patient love their hearing aids the way that my 10-year-old does? And it boils down to those simple things, even like that: memory, cognition, expectations. That child doesn't have an idea of what they remember was normal. That is their normal. And so cognition is something we could talk probably for a couple of hours about, with each different thing that we could go through. A good friend of mine, Dr. Roy Ball, is a retina surgeon. And, you know, as he and I talked about how important is vision compared to hearing. And he says, if I can fix their vision, they don't ever complain about their hearing. But if I have hearing loss and I fix that and the person can't see, it's blamed on hearing. I'm not hearing well. If I could fix their vision, I tell him, I think I'd be in a lot better position. And so he's someone I work with a lot to help people understand, yes, you can hear now, but I need you to be able to see well to get the cues needed to honestly do your best. And so vision is not necessarily cognition, but in a lot of ways it is, because we're adding all of these things and we kind of boil it down to, well, I'm not hearing well. So if anybody has anything they want me to go into more detail about at the end, let me know, because again, I could talk about this for almost probably its own class if we wanted. From here, I'm set to go kind of right into COVID. So is that okay with everybody, or does anybody want to stop me now and talk about any of the stuff we addressed? I don't see too many here on the chat.
I just had a question, what you were talking about there. So if you're saying an older adult has a gradual hearing loss and they get a hearing aid, then they're not going to adapt as quickly as a youngster to it's not being restored. Are you saying then basically the neurons have to rejoin? They have to basically learn to refire and talk to each other?
Not the refiring part, but once they fire and we get that information up to the brain, and that is affected more by the amount of time that you've waited to get a hearing loss rather than necessarily your age. So you can have hearing loss at 20 and wait 10 years, and it's still going to be a problem versus if you were 40 and only waited 2 years, right? Because no matter what age we are, if you're, you know, people that are born with hearing loss are born deaf and they've been deaf for 30 years, they're a different candidacy for an implant because their brain hasn't gotten that stimulation yet. So it's a matter of when that stimulation stops or never started and when we actually stimulate it again. As you get into things like memory and dementia, that's a whole nother part. But what you're talking about is, yes, you haven't heard that, so you're not used to it. So the neighbor's dog barking is more bothersome because it wasn't needed, so your brain factored it out. Whereas a younger person, they want to hear the dog because that means something totally different to them. So it is a matter of retraining and relearning. They're also in the method of, they're learning already. You know, you get into a point, you know, and you're, even myself, I got out of graduate school and I didn't want to read a book. I didn't want to learn for a while. So when we ask our older adults to relearn to hear, well, they're learning that, they're doing other stuff. They don't have time to relearn that. Whereas younger kids especially, well, they're already learning. So everything's just treated a little different. The attitude is totally different, that's for sure. There's a question in here that I'll address briefly, is about the time it takes to adjust to a hearing aid, depending, it says if you have a loss. the adjustment that I see with my patients is the longer they've gone without hearing, the longer it takes to adjust. Also, the more mild the hearing loss. It's not that the people don't adjust faster. They just come in and say, well, I only need this when I go to restaurants. And I tell them, well, you have a hearing loss when you're talking to your wife as well. But they've created a communication, bridge that they feel like they don't need it. So they take longer because they're not wearing it consistently enough. So it takes longer to adjust the longer you've had the hearing loss and not treated it. And also, if you get a hearing aid and you're not committed to wearing it as many hours a day, you're going to take longer to adjust to the hearing aid as well. And if you quite frankly don't think you need one, so those husbands that come in, and wives too, husbands, wives, is she thinks or he thinks I need it, I don't. And I tell them you don't get a hearing aid, because if you're not ready and you don't want it, it's not going to be an easy thing. All right, is everybody ready to go into just some of oh yes, please.
Hi. I know that I have a bit of hearing loss. I obtained it many years ago now when I was working on the railroad. And I was running trains, and the sound of the rails when we went around curves, rusty curves, and stuff like that, I lost some of my hearing during those years. But the only time that I really notice it is when I'm in a room watching TV, and I need to turn up the TV to hear well, and other people in the room start, sometimes they'll mention that the volume's kind of loud. So it's been many years since I originally lost that hearing. Does that mean that if I get I don't know if I should get a hearing aid?
I think I know what you're asking.
Yeah, okay.
So your ability to distinguish the words is only going to be affected if your hearing loss is severe enough that you're not hearing sound. I'm sorry, ask that again. I'm
sorry, my computer froze in the middle of that sentence, so I didn't hear the whole sentence.
Okay, if you have a slight amount or mild hearing loss, the fact that you don't wear a hearing aid doesn't mean that your brain is forgetting how to hear. Okay. So we would test if you came into my office, I would test your ability to understand words. And if that is still relatively high, it doesn't matter that it's been many years. The main thing for you now is to understand how much loss. So when you look at a hearing test graph, if 80% of the word is being understood and heard, you may not even be a candidate for a hearing aid, but we may say TV is your issue. So we can find a device that you can use so you get the stimulation and you get the good hearing without affecting the people around you. And so it's important to look, and a good hearing test will tell you that. I would say the best thing for a hearing aid is if you have, again, if it's just television, are you going to put it on every day and wear it? Or are you just going to wear it for TV? That's what I would ask you. And
well, considering I'm not going outside of my home at the moment, it doesn't matter,
Yeah. And going back to the beginning, a good hearing test will answer that question for you. And if you need to have, even if we're not going to restaurants, if you're struggling, you need to have 2 or 3 things at least that you can evaluate whether a hearing aid is going to help you. Because ultimately, that's what I do with all my patients. Go try it. I'm not here to convince you, nor can I take a test and predict if you spend this and buy this, you will get this. It doesn't work that way. And so for you want to go to a place where you can just try it and wear it and see, is it going to help me with the places that I need it? But no, you're not at more risk because it's been long, especially being that your hearing loss is likely in the higher tones only. So you're probably hearing normal to mild in the main tones, and then you've got some noise-induced hearing loss.
Okay, thank you.
You're welcome. Okay, so the last thing we're going to do is talk about COVID and how it's impacted us with regard to communication. And I will start off by saying we have seen patients that have come in that are getting residual hearing loss that was not there before the virus, tinnitus or ringing in the ears that was not there before the virus, excuse me, and was there after. And so anybody wondering if this virus is having effects on hearing and hearing loss, the answer is yes, we just don't know to what degree yet. And we continue as audiologists, patients coming in to try and track some of that data and even share it with the state so we can see if there's any long-term effects. So I wanted to say that in case anybody was wondering. And the biggest thing for us has been wearing masks and having to communicate with people with masks. And the two reasons that is, one is to take away the visual part of it. And when you do that, even with normal hearing, it's difficult. You take away any visual cues. That can be lip reading. It can be, a smile versus a frown. And that has been difficult. Number two, it's been very difficult because wearing a mask decreases the volume of your voice. Studies are showing up to 12 decibels. That takes a normal hearing loss and gives you mild loss, takes a mild hearing loss and gives you moderate, and takes a moderate and gives you severe. Add in those barriers that are in the banks in certain places, you're probably talking 15 decibels at least. So a lot of people that hadn't struggled before are coming into the office now and reporting it a lot worse than it is. I don't know how long we'll wear masks, but if you're feeling that, the best thing is to come in and get a hearing test so we can ease your worries and figure out where we are and where we're going to be after this pandemic's over. I've seen really clever masks that say I'm hearing impaired. I have a young woman who's deaf and it says I'm not rude, I can't hear you. This pandemic has affected hearing impaired people to a different degree. And once it's done, I plan to put out some marketing, not marketing, but informational stuff. So people understand what the hearing impaired population went through during this. The last thing is when people wear hearing aids, we're having a hard time keeping them on the ears. And it has become an issue that I hear of daily. If you're having that problem, reach out to your audiologist or call my office. We have some clips and some things we can give you that will get the masks away from the ears and hopefully mitigate loss and things like that. So we know that this issue exists. Hearing aid companies know that it exists, and there are things that are coming out daily. We've had the masks that you can see through, which they're difficult. My office has them. We try and use them when we're dealing with someone who's really hard of hearing. And so there are solutions that we're coming up with. I don't know we'll have a perfect one by the time we just don't have to wear masks anymore. But certainly if anybody has specific questions about that, you can call my office or email me, and I would be happy to give you information on different things we can do to try and help if you wear hearing aids. And then if you don't wear hearing aids, but you're struggling with communication, I have put some handouts together with just some general ideas of things that people that are hearing impaired that aren't wearing hearing aids can do communication wise, and that you can share with your family that they can do on your behalf to help with some of this. And it wasn't designed for COVID. It was designed for communicating with people with hearing loss. But I certainly think you might be able to pick out a few things on your end and also share with your family on how they can communicate while we're wearing these masks and covered up. So those were the last things that I had on my list to talk about.
Thank you, Kathleen. What we're going to do, we'll turn it over to Susanna now and let her have a few minutes, and then we'll open it up to general questions. Yes, Harriet, you want to unmute yourself? Harriet, you want to unmute yourself?
I see something that it was from you, Anne, about the Boss device
Let's
for
the
restaurants.
Yeah, we'll go on. Let's go on to Susanna right now, and then we can get to those questions after she has her time. Okay, we'll just open up the general question.
Unless Kathleen thinks it should be addressed now. It might be more confusing later.
Well, I can give a quick answer on it, and that is that those types of companies are now coming into the hearing healthcare world with regard to hearing loss. And the main thing is to find out if they're designed for people with hearing loss or not. And that's where I would have to do a little more research on my end for that particular device to find out how much research is done for people with hearing impairment. And so for right now, I would caution on some of that. Make sure you can try it and see if it fits.
All right, we will go to Susanna and welcome. We are glad to have you. Susanna joined us one time with our fall prevention class with Maria's and my fall prevention class. So she's going to give you some information on the state and the certain things that the state can do to help with hearing.
Okay, well, thank you. Good afternoon, everyone. Thank you for the opportunity to provide the information regarding our services. Again, I'm Susana Santillan with the New Mexico Commission for Deaf and Hard of Hearing. I'm the community advocate specialist. And what we do at the agency, we promote services for individuals who are deaf, deafblind, hard of hearing, and or if they have speech disabilities also throughout New Mexico. So our services are, my focus is mainly to advocate do individual advocacy or system advocacy to break down the, for individuals that are facing communication barriers, such as like what Kathleen was mentioning, with, wearing the mask or just sign language interpreters, how to get some sign language interpreters. So my job is mainly to educate. A lot of people hear the word advocate and like, oh, they're coming. But my job, I feel that is, I'm educating the community, whether it's the client or as the entity that needs resources, how to better serve their clients that are deaf or hard of hearing. So I provide guidance and resources regarding reasonable accommodations we provide free presentations to educate regarding hearing loss awareness and such topics like hearing loss sensitivity training, effective communication, ADA, American Disability, which is a law to educate the entities, that they have to be accessible. We provide a lot of information and referral to the community. For example, they might ask me for, where can I learn sign language? I would like to learn that because my daughter or son is deaf. Where to obtain a sign language interpreter? Who pays for a sign language interpreter? Information regarding telecommunication relay services, where sometimes there's individuals that don't have health insurance that covers hearing aids. So there's what we call a fact sheet that we provide individuals for. It's financial assistance for hearing aids. They might qualify for it. There's also discounts on phone services through the New Mexico Lifeline that we can provide you information about that as well. So there's a lot of resources. And if I don't have the information, I look it up and try to find something for you and get back to the individual. So one of our most popular programs that we have is the telecommunication equipment distribution program. So that's what I'm going to demonstrate today and talk a little bit more on that. I call it the TED program for short. And in this program, lends devices at no cost to qualified New Mexico residents for assisting with communicating on the phone. Devices that amplify sounds like amplified telephones, iPads, speech generating devices, neck loops, and more. So these devices are mainly for, I think I already sent the information to Ann, and she'll send you all the information, the guidelines. But if there's any questions at the end, I'll be happy to answer them. For the TED program, to qualify for it, you get a choice of first a primary device, either an iPad or a home phone, and 2 accessories. The iPad is, to qualify for the iPad, you do need to have internet service at home. You get either an iPad Air, like this one, or an iPad Mini, which is a little, some people like the iPad Air, which is bigger, and they can see pictures and talk to their families and stuff through video. And the iPad Mini is just like half some people like the small one because they can carry it in their purse and stuff like that. Also, if they want a home phone, some individuals have, there's a few still that have home phones, landline phones. So we have a lot of home phones, some that you can see in the background. I don't know if I'll have access to show you the catalog online, but if I can be, if they can share, let me share that information or that catalog online, I'll do it. Will I be able to share that, Anne, or can you make me like a host to share it?
I have share screen. I will do that right now. There you go.
Okay, thank you.
Mhm.
There it is. Share. Okay, this is a catalog that you'll see online. Some people don't have access to internet, like I was saying earlier, but we can either mail you the catalog and the application, or you can go online and look at it. I won't go through the whole thing because it has a lot of devices, but if you can see at the beginning, it starts with home phones that have mild to moderate hearing loss. Like Kathleen was saying, it depends on your hearing loss, depending what you're gonna need accessibility on the phones as well. There's different phones that are cordless phones. And then you can see on the catalog, you can see that it describes what it is, you know, and the cordless, if it has a caller ID, it tells you also how many decibels, mild to moderate hearing loss, 25 to 50 decibels. So you can see there's big phones with big numbers. Some of them light up. Some of them are good for people with hearing loss and visual impairment. We also have the moderate to severe hearing loss. So there's several of them that you can just go through the whole catalog and read it and just see which one would be best for you. We do have one that's really popular with our seniors that if this one that comes with a bracelet, it's sort of like an alert system necklace, but this one is a bracelet that you wear on your wrist. And it's what you do, you program the phone up to 6 phone numbers. And if you happen to fall or get, you know, you can't reach the phone for some reason or any other, you need an emergency, you press that button, the red button, and it'll dial the first number that you program. If nobody answers, it'll go to the second one and on until somebody's reached. I always recommend to put the 911 on it. The same with, here's some for people that forget their phone numbers and they can use pictures, or some people just like to put a number there. So there's a lot of information regarding the iPads, as I was saying. Also, the iPads are programmed according to your hearing loss or your disability. For example, here we have the one for the deaf. The deaf have different icons that you can use, like for video relay calls and captioning phone calls. We also have the one for the deaf. The deaf blind has different icons as well because they need visual icons to be able to be accessible for them. The hard of hearing, each one, depending on your disability, you'll have that certain icons set up for you already, okay? So once you receive it, you'll be able to use it. So I won't go through the whole thing, but I'll demonstrate two of the technologies that I have that are very popular, but further down, you'll see the accessibility and accessory devices that we offer. One of the most popular one that we show, or a lot of people choose, is this one. Let's see if I can show it. It's an alarm clock. Oops, there. It's hard to find that. This alarm clock notifies you. We call them a notification system. What it does, it notifies you if the doorbell rings or the phone rings or your alarm clock goes on or the smoke alarm. It comes with a doorbell. I'm gonna press it. You'll see how when I press the doorbell, it's supposed to work. Aren't you working? Of course. Well, it comes with a doorbell, and normally it's supposed to work, but it's not working. Don't tell me my batteries are low. Yeah, it's showing that my battery's low, and I only have that set. So this one comes with a doorbell, and it's supposed to, when it rings, it says here door. I apologize, I didn't realize my battery died. I just used it yesterday and it was working fine. But it comes with with a bed shaker. So what this does, it shakes. You can put it underneath your pillow or your mattress, and it vibrates like a cell phone. And it comes with another one for the living room or the kitchen. So you get 2 of these, one for the bedroom and one for any room that you want to set it up with. You can set it up in the living room, the kitchen, or the place that you're most likely to be most of the day. So in case you hear the phone ring or the doorbell rings, it'll tell you it's the door or if it's the phone. There's the other device I wanted to show you real brief is this one. This is an assistive listening device. Kathleen was talking to you about the telecoil and the loop. If you wear a hearing aid with a telecoil, this is a loop. This thing that you hang around is considered a loop. What you do, you connect it, this assistive listening device, you connect it here. You press on the green button to turn it on. You know it's on because the lights are all on. You can lower it or raise it according to your choice, I guess, depending on your needs. So you have to have a hearing aid with a telecoil. What you do is you press a T on the back of your hearing aid, the telecoil. You press the T on this one, and you can amplify your sound on your hearing aids. The other day, I had a young lady who her hearing aids broke. So she sent them to have them fixed. While she did that, she used her earbuds, wireless earbuds. You can also use headphones. And what she does is she used it while she was getting her hearing aids fixed. And she said she was able to hear with her earbuds. Some people use headphones like this that you can buy on Walmart. I don't know, you hear the sound. Can you hear it? It really gets really loud. So you can bring it, lower it, or raise it as much as you want, depending on some people use it to hear the TV. Sometimes they get tired of wearing the hearing aids all day. They just take it off and they just wear a headset. So there's different, like I said, other devices that you would be interested in, but these are the 2 most popular ones that I see our clients ordering more. We'll send you, like I said, if you don't have access to a printer or internet, you can request, you can contact me and I'll send you the information of the person in charge of the technology. But we have an application. It's really simple to fill out. It just requests all your information. And we do request, you choose what technology you want here, your primary device, and then the 2 accessories. And then on the back, it has the documentation that we request for you to qualify for our program. You need to provide a copy of your audiogram, which is proof of your hearing loss. And it doesn't matter if you only have hearing loss on 1 ear or 2, how mild or severe, as long as you have some type of hearing loss. Doesn't matter your age as well. Also, you need to provide proof of residency that you live in New Mexico, like your driver's license or your ID. And then some people say, well, I just moved to New Mexico. I have been here and I haven't changed my driver's license. You can provide a utility bill that has your physical address, no PO boxes. And then we also request, if you want the iPad, you need to provide proof of internet service. Or if you want a home phone, you need to provide proof of your telephone service. If you only have a cell phone, then you only qualify for 2 accessories. So you can provide that cell phone bill. And that's it. Any questions?
What we're going to do now is we will open it up to general questions with both Kathleen and Susanna. So we've got about 10 minutes for that. So you can unmute yourself and maybe raise your hand, and we can do this one at a time so everybody can hear the questions and the answers.
And do you want me to go through the ones that are in the chat?
That would be great. Thanks.
Okay, I'll start there, and then if there's any more, we can go to that. Okay, there were a couple questions, Kathleen, these are probably directed to you, about what causes tinnitus. Someone mentioned that dog barking causes tinnitus, and are there any treatments available for it?
So the cause of tinnitus is a huge umbrella of things from noise exposure, hearing loss, diet, medications, trauma to the ear. And so there's not a straightforward cause. And honestly, when people come in with tinnitus, it's not often that we know exactly what causes it. certainly if you're exposed to a loud, let's say, dog barking and it's a really loud noise and the tinnitus only happens when that loud noise is there, we would, we could assume that that's what the cause of it is. But again, it's unlikely that that in itself is going to cause tinnitus. The treatments of it would be if you could pinpoint it. So if it was a medication that you're taking, I mentioned with our COVID patients that are coming in and they have tinnitus, and once they've, you get rid of that cause, whether it's stopping the medication or getting rid of the loud noise that's causing it, we could see that yes, the tinnitus stops. For treatment, if it's always there are a lot of sound therapies that are being advertised right now, which can have some, success. One of the ones we use at my office that tends to be the most successful for the most people is a form of what's called masking. And you can Google it, and you can Google tinnitus sound therapy or masking. Essentially, to make this short, it's a giving yourself a sound other than the ringing or the buzzing or whatever noise you're hearing to listen to, so that it's not as distracting. And we can do that through hearing aids, and certainly people can do it by just putting a fan on in the room at night. It's a very loaded question, and I would be happy if somebody wants to talk more about it. You can email me. We can talk on the phone. You don't have to come into my office, but that's the quickest answer I could give. That's hopefully enough to answer what the question was.
Okay, thank you. And Kathleen, could you address assisted hearing devices they're sort of generic, like reading glasses, and are they helpful?
They are. Anything that can do, and we just heard about the phones, and those are all assisted listening devices that are available, that some you do need a hearing aid to wear, but others you don't. And so absolutely, even if you wear hearing aids and you take them off at night, having some of the devices that we were just shown is huge, right? If your bed could vibrate, your pillow could vibrate, if your alarm goes off because you don't hear it because you're not wearing hearing aids or don't have them in, those things are amazing. So I'm a huge advocate of anything assistive or to add on. The reading glasses part, there are over-the-counter types of hearing aids that are coming out. And a lot of people think audiologists don't like them. And I actually think that it's great for those people that maybe just have a very mild hearing loss, but we can start to get stimulation. So it's not going to fit people with a severe loss, but that's considered a type of over-the-counter assistive device. And I'm sure Susana would agree, any of this stuff that you can get the stimulation and get that help is going to be great, whether you're tied to hearing aids or not.
Okay. So there's a lot of stigma associated with wearing hearing aids, I think, because they're visible and tend to lead people to believe that you're old and, but if you let it go, I have heard that the nerve endings in your ears will die if they aren't given some kind of help. Is that true?
Yes, that makes it sound more severe than it is. Cell atrophy, which is cell death, does occur when a cell's not used, and that can be in the ear, in the eye. If it's, if you're not moving your hands, that is true. And when you have hearing loss, or even if you had normal hearing and you were stuck in a quiet room for 10 years, yes, when you don't get stimulation to the inner ear, those cells can be affected. Auditory deprivation is probably a better term versus cell atrophy that says your nerve's going to die and you need to do something. The reason I say that is because it can regenerate. So auditory, when you start stimulating it, there is data to show that those connections they can come back. The problem is we don't know how quickly or how much. So you may go from 24% understanding to 49%, and to you go, that's not worth $4,000 in hearing aids. But to a scientist, that's huge. You've regenerated. So yes, auditory deprivation does happen, and there is a sense of cell death or atrophy. But the good news is with stimulation, we can get some of that back. So I don't necessarily like the term death.
Okay, that's fair enough. Someone else asked a question. If they get a hearing aid, can they get a 30-day sort of money back guarantee or a free trial period?
Yes, The state of New Mexico says that anybody who purchases a hearing aid, pays for a hearing aid, has to get a 45-day money back guarantee. The catch to me, it's not a free trial if you have to pay some sort of restocking fee, which is what I have heard around the community is, I'm gonna pay you $4,000, Kathleen, and if I don't keep these, you can keep a $300 restocking fee. And the state law allows for that. And so everybody who purchases gets 45 days. To me, and at my office, 2-week free trial means there is no financial obligation unless you lose my hearing aids, then you have to buy them. But so there's a difference. So if somebody tells you, you can try these for 30 days, but you get your money back, the question to ask is there a restocking fee? Generationally, and I speak culturally, I'm from Northern New Mexico. I think about my parents, my grandparents. When you sign a contract, there is a sense of obligation. And so that history in me, I don't like people to sign a contract and feel that they're obligated and they've already paid this money to feel bad coming in. So what I would recommend is ask for a true trial. Can I wear these for 14 days and decide if I want to purchase? Because then after you purchase, you have the 45 days. So that would give you over 60 days. That's more than enough time. It's rare that I have a person after 60 days go, I'm not sure. It's either this didn't help or yes, this is helping. And that way you're sure about what you're purchasing. But don't get that confused. I see it advertised all the time, free trial, 45 days. There's an obligated 45-day that the state gives, and you should have that on top of a trial. That's my opinion. Know the difference is what I'm suggesting. When somebody says it's a free trial, know the difference and ask that question.
Okay. Are there some effective strategies that you could talk about and suggest to people who are dealing with family members that refuse to acknowledge hearing loss, and having those conversations with them to convince them to go get a test and get fixed?
Yes, and I don't want to take too much time, but I want to just make sure that everybody knows that the handouts that I send address this specifically in a very quick listed way, right? Tips for the communicator and tips. And I think that the easiest thing is to not get frustrated and upset, and to explain to your loved one, this is not for you. It's not that I'm willing to slow down. I'm willing to do all of this. But no matter if it's a hearing aid or a family member changing that communication, there has to be a knowledge of what the loss is first. And so my biggest success when a husband's there or a wife's there, and is a lot of times if they'll go in together, we're both going to get tested. So it's not just a problem on one end, we're both going to get tested. I've seen son and daughter go in. Well, I'm going to get tested too, right? The other one is to make sure that they know they're not being tested to get a hearing aid. There's other things, we talked about them today. Maybe you just need a phone. Maybe you just need one of these devices that Susana can offer. Some of them are free. If somebody knows that they're not obligated to buying an expensive hearing aid, they're more likely to go in. And again, using some of the resources that we just heard about, I've told plenty of people, you don't need a hearing aid. I can give you other resources, but if you don't want to wear the headphones, hey, it might be a hearing aid. So I've found that people are more likely to go in if they know there's options other than hearing aids.
And then I actually have one question. Does Medicare cover hearing aids across the board now, or are they beginning to?
Not across the board. Press Senior and I believe United have come up with what they call a hearing aid benefit. And I'm going to speak this and tell you what it is with 100% confidence that it is accurate. And I would urge you, if you have this insurance, to call and double check me. Because I don't want it to come across as they've asked me to participate and I've said no. And the reason is what they've done with Presbyterian Senior is they've contracted with True Health, which is a hearing aid manufacturer. It's an online deal. They don't have a store you can walk into. And so the hearing aids are still at a cost of $700 to $900. You're going to get a hearing aid that is likely, the ones I have personally seen say True Hearing on them, which means it's a proprietary. You can't go to any office and get it programmed the way you can. I think Harriet, if you look at her brand, she can go anywhere in the world and find it. True Hearing, not so much. They contract with a person like me and they pay us a small fee. And that's to fit it and to see you 2 times. So you get 3 visits. Now they're done with you. You've paid them your money and you're dealing with my office. So I say, well, I see my patients every 6 months. If, Harriet needs me, she can call tomorrow and get an appointment next week. And I don't charge for that because I think that hinders people's willingness to come in. What they've done is they've told the audiologist, but they've told me is, well, you just bill her every time she goes in. That's how you make up the difference. So that means anytime Harriet wants to come see me, I got to bill her $50. She might need me twice in a month. And because of that, I don't agree with it. And you can get a hearing aid for the same cost at my office, but I'm going to service it as long as you have it. United Medicare is doing something similar, but they're telling you hearing aids normally cost $4,000. So we're going to give you a $1,500 discount. So you pay the difference and it's the same type of thing where they're asking the office to make their money, if you will, in servicing you for 4 years is by charging you every time you go in. So if you have one of those and it's Press Senior for sure, I believe that there's a United, if they say it's through United Hearing, ask the question, call the office that you're going to and ask the question, what's my out of pocket? Because I doubt it's $0. And then find out if I need you in a year, if I need you, what's my cost to go see you every time? And if you're happy with the answer you get, I think it's a great solution. I wish Medicare would just give people a benefit. $500, go where you want. But that's what's going on now. The scary part is they're not advertising it. I see the commercials. You now get hearing aid benefit. That's my honest knowledge about it. Again, I would encourage y'all, if you have that, if it's call and tell your representatives, that's not what we want. We want you to pay money for us to go where we want. So long, maybe winded answer, but that's what's going on with some of the Medicares right now that are claiming a hearing aid benefit.
Okay. So Ann, I think that's all the questions that were on the chat.
Susanna, can I make sure and get your contact information? I have some stuff for you that there's a couple of hearing aid manufacturers that are giving us really cool informational sheets for people to take to their bosses and their workforce with places to go to advocate for maybe even helping them with hearing aids.
Sure.
I'm not sure if I have your email or not.
I'll put my contact information on the chat right now.
Awesome. Thank you.
You're welcome.
And we will be putting this up online tomorrow on our blogs and any of the information that both our presenters have. And we really appreciate you coming and thank you. It's very informative.
Very
It's
good.
a very, very hard area to navigate because it is rather, first of all, it is not covered by most of insurance. So it is hard to just step up there and say, I'm going to do it. And how do I do it so I actually get what I really need and in the most effective way? We really appreciate this. Thank you so much.
Thank you, everybody, for having me.
Thank you.
So much, Kathleen,
Thank you.
for coming and
All right.
doing this today. It's wonderful.
Thank you. I'm going to end the meeting. Thanks a lot, everybody.
Bye.
Thanks, Ann.
Bye.